Hello and welcome to the second Climate Change and Human Health webinar hosted by the Scientific Advisory Group for Emergencies, or SAGE, which is hosted by the Academy of Science of South Africa. We have two excellent speakers today, and both are focusing on the concept of heat and human health, with a particular focus in Southern Africa and South Africa. First of all, we have Dr. Katlego Nkongwani, who is a lead scientist at the South African Weather Service. She leads a weather, climate, and health application research group whose objective is to advance knowledge and understanding of weather and climate risks to human health and to develop products and services to strengthen the resilience of vulnerable communities. Her research interest is on weather and climate and their associated impacts on environmental exposures and vector-borne diseases. Dr. Nkongwani has a vast experience in managing biometeorological observation networks, which are critical in providing key information for end users in a variety of human health applications. Dr. Nkongwani has a PhD in environmental sciences from the University of KwaZulu-Natal. She also holds two master's degrees, a Master's of Science in Physics, also from the University of KwaZulu-Natal, and an MPhil in Sustainable Development Planning and Management from the University of Stellenbosch. Then our second speaker today is Dr. Thandi Kapwata, who holds a PhD in Geography and is a specialist scientist at the South African Medical Research Council within the Climate Change and Human Health Research Program. Dr. Kapwata is also a research associate at the Department of Environmental Health, the University of Johannesburg. Her research focuses on environmental risk factors affecting health in Africa, the application of GIS and spatial statistics in epidemiology, and understanding the health impacts of exposure to extreme climate variables. One of her areas of interest relates to the health impacts of exposure to temperature extremes in the form of high temperatures and heat waves, particularly in rural and vulnerable communities. Her current projects include cohort studies assessing heat health impacts, including physiology, and the implementation and evaluation of climate adaptation measures. So first off, over to you, Dr. Nkongwani, and followed by that we'll have Dr. Kapwata.
Greetings, my name is Katlego Nkongwani. I'm a lead scientist at South African Weather Service. I lead a group that conducts research on the complex interactions between weather, climate, and human health. My presentation today will be on extreme heat and heat wave characteristics in the context of climate change. According to the newly released Intergovernmental Panel on Climate Change report, global average temperatures have increased by 1.2 degrees Celsius since pre-industrial time. And it is noted that the increase in South Africa is at least 1.5 times more than the global average. And in the absence of the much anticipated policy shifts to limit greenhouse gas emissions, observed temperatures are on track to rise by 1.5 degrees by the year 2030 and by as much as 4.8 degrees Celsius by 2100. The increase in both the global and local temperatures have resulted in a shift in the mean temperature distribution as demonstrated by the bell curve schematic on the right side of the slide. So if the world continues to warm, we have to look forward to hotter average temperatures that result in hotter days and extremely hot nights. Well, this is accompanied by more record-breaking heat spikes, while on the other hand, for some regions, we will experience far less cold weather. But it does not mean that cold events will eventually disappear. So what are we observing in terms of local conditions? So the Department of Fisheries and Forest and Environment has predicted that by mid-century, the South African coast will warm by 1 to 2 degrees Celsius – and the interior by around 2 to 3 degrees Celsius. The increase has been noticeable in the Northern Cape province as well as selected regions over Gauteng, Limpopo and KwaZulu-Natal coast. This slide displays the annual mean surface temperature for both RCP 4.5 and 8.5 for both the near future and far future projection period. As clearly demonstrated by the RCP maps on the top panel, the country is warming up. More warming is evident in Limpopo and Northwest Province. In the far future period for RCP 4.5, we are seeing more warming between 2 to 2.5 degrees Celsius for most part of the country, with regions in the Northern Cape, Northwest Limpopo, Free State Province having intense increase in temperature over 2.5, as represented by the red color on the maps. RCP 8.5 scenario indicate even more warming for the country for the near future. The magnitude is almost the same as the far future for RCP 4.5. Meanwhile, even greater warming, more than 4 degrees Celsius, is observed for the far future throughout and will worsen in the absence of the stringent climate mitigation efforts. Assessment of historical trend of surface temperature in South Africa show a general warming trend with accelerated warming observed in some parts of the country. As depicted in the figure on the left, relatively strong warming is observed in the western, northeastern, and eastern part of the country than in the interior. Turning our focus on the figure on the right, relatively warm thermal regimes that are more prone to hot daily extremes are observed in the low-veld region in the northeast of the country as depicted by Cluster B, thus encompassing regions in the east coast and dry western interior as indicated by Cluster C and Cluster D as shown in the figure. Significant increase in warm spell duration are evident over most part of the western and northern interior of the country. As a consequence of unprecedented rise in global mean temperatures, we are seeing local extreme outcomes that include increase in record-breaking temperatures, increase in veld fires, increase in heat wave and extreme heat events, and hot spells. Accelerated warming means high records are likely to be broken at a higher than expected rate. Take for example in 2015, about 20 regions across South Africa set new maximum temperature records. The highest record of 48.3 degrees Celsius was reported in Vredendal, a town in the west coast in the Western Cape province of South Africa. So we are likely to see an increase in record-breaking temperatures as reported in the study by McBride, who assessed the occurrence of both minimum and maximum temperature records for selected number of stations covering period 1951 to 2019. So shown on the map are spatial distribution of annual average number of observed temperature record for the period 2010 to 2019. On the right are spatial distribution of minimum temperature records, and you will note that regions such as Kimberley, Johannesburg, and Pretoria will observe high minimum temperature records. On the left are spatial distribution of maximum temperature record, and you will note from the map that stations over the central part of the country show maximum temperature records. Increase in average temperatures will also result in devastating wildfires that are on the rise and have significant social, economic, and environmental impact. Take, for example, the Knysna fires that affected part of the Garden Road in the Southern Cape in 2017. You'll note that over 10,000 people were displaced and some lost their lives. So low household income, most of whom are living in informal settlements, are among the vulnerable. Turning our attention into heatwave outcomes, you will note that universally there is no accepted definition of heatwaves. The definition applied locally is one when maximum temperature at a particular town exceeds the average maximum temperature of the hottest month by 5 degrees Celsius for that particular place and is persistent for 3 days. So for ease of use, the Weather Service developed a spatial representation of heatwave thresholds as shown on the map on the slide. As depicted, the heatwave spatial threshold varies across the country, with higher thresholds with values between 42 and 44 noted in the northern part of the country. So when all the conditions that are specified by the local definition of heat waves, and if those conditions are met and exceeded, then a heat wave will be declared. Most studies on heat waves has turned attention in understanding heat waves in terms of frequency, duration, intensity, and timing. A local study, Bogotá et al., investigated the association of heat wave in South Africa with interactions of El Nino Southern Oscillation. In their study that was published in 2022, it was established that indeed ENSO has shown to influence South Africa's heat waves, but the signal or the strength differs across the country. So shown on this slide is some of the results. On the left-hand side is the spatial correlation of ENSO derived from NINO 3.4, a very commonly used index that shows ENSO event. On the right side of the slide are the temporal correlation. So in general, the study showed that the northern and eastern part of South Africa have a strong ENSO signal, and it is these very same regions that experience very hot days during ENSO season. Shown on this slide is the sum of all heatwave events between the period 1981 to 2020. And you will note that the austral midsummer season has the most heatwave events, with the month of January experiencing the highest record in heatwaves as represented by the noted peak on the slide. Drier conditions are also observed during co-occurring El Nino seasons. So building up from the previous figure, these graphs show that drought seasons coincide with high frequency of heatwave occurrence. While there is a significant relation of drought and heatwave events, duration and intensity does not have a significant pattern. Shown in this slide is the image from the model output of one of the longest heat waves we experienced as a country in the recent month, and this supports the findings from many research studies that heat waves are increasing in both frequency and duration. So the country was hit by heat wave from the 3rd to the 8th of October, and affecting regions in Gauteng, the Highveld of Mpumalanga, southern and western Bushveld, the central and the northern west of the Free State. So the Weather Service issued an advisory on different platforms, advising the public of the potentially life-threatening heat wave events that will last almost a week. So the impact-based messaging is also shown on the map provided by the Weather Service, did communicate the potential impacts as well as interventions whereby people are able to take necessary actions to protect themselves from the imminent weather. Now let's turn our attention to extreme heat events. So extreme heat events are characterized by weather that is substantially hotter and more humid for a particular location at a particular time. So long-term trend studies and analysis are showing an increase in the frequency and intensity of extreme heat events, similar patterns observed with heat wave events. In countries like the US, extreme heat are the most prominent cause of weather-related death, responsible for more death than hurricane, lightning, tornado, flood, and earthquake combined. We have also noted that while heat affects everyone, there are certain segments of the population that are more vulnerable than the other, and that include the elderly, children under the age of 5, the chronically ill, the socially isolated, and high-risk occupational groups that are vulnerable to heat and are likely to suffer adverse heat-related impacts. So targeted interventions for such groups are therefore needed in order to protect the people from extreme heat impacts. In South Africa, a number of extreme heat research has been conducted, thus mainstreaming actions in heat health research and development. Shown on this slide are results from one of the local studies that developed a heat-stress climatology based on hourly ground-based data from 51 stations that are managed by the South African Weather Service. As shown on the slide on the left are hottest towns that are represented by the red color, and these towns are found in the Eastern Western Cape province, as well as KwaZulu-Natal, Limpopo, and Mpumalanga province, and are considered areas that are most vulnerable to extreme heat. In these regions, values of between 39 and 50 degrees Celsius were observed. So the non-parametric man-candle trend test was used to assess the heat stress trends, and positive and statistically significant trends were found in 88% of the study stations, with roughly 47% being statistically significant at 5% level, as shown in the map on the right. Spatial overview of vulnerable areas and population exposed to extreme heat provide relatively simple and direct methods of transmitting information on heat vulnerability to various stakeholders and actors within and outside government. So shown on this slide are heat risk assessment maps that were developed using the IPCC methodology for vulnerability and risk assessment that is based on both socioeconomic indicators and Codex data. So from the maps, you will note that South Africa will be impacted by heat risks during the period 2036 to 2065, as well as between the period 2066 to 2095 projected period. And this is for both the RCP 4.5 that is represented by the map on the left and RCP 8.5 emission scenario on the right. So spatial information or product solution are important for targeted heat adaptation strategies in South Africa, and also allow resources to be channeled to areas that are most vulnerable. In summary, climate models indicate that extreme heat and heat wave events will become more common due to climate change. Heat health-related policies and associated adaptation strategies that targets vulnerable groups and different climate-sensitive sectors are critical and must be implemented at all levels of government in order to minimize impacts of extreme heat and heat wave events. So in addition to the development and implementation of efficient community-based early warning system, we must also put emphasis on natural interventions, such as planting of trees, particularly in informal settlements, in order to strengthen resilience. More importantly, as a country, we must increase heat health literacy. And lastly, we must involve communities in the co-development and co-design of heat-related solutions. So this brings me to the end of my presentation, and thank you so much for your attention.
Good morning, everyone. My name is Tandi Kapwata. I work at the Environment and Health Research Unit of the South African Medical Research Council. My presentation today is based on one of our recent publications within our unit, where we looked at an analysis of past and future heat waves, which we based on a heat-related mortality threshold. This is part of our work towards developing a heat health warning system for the country. So heat waves can have severe impacts on human health, and these extend from illness to mortality. This image here on my left, sorry, on my right, um, shows the pathways through which heat extremes that are caused by climate change can affect health. This is particularly important because we have been seeing trends over most of South Africa that show general warming trends. We're seeing increases in average, maximum, and minimum temperatures. So not only are temperatures increasing, but we're also seeing increases in the duration, the frequency, and the intensity of heat waves, and we refer to these as climate drivers. We're exposed to climate drivers through two main pathways, and that's elevated temperatures and combinations of temperature and other meteorological variables, such as apparent temperature and heat index. So the possible health outcomes that are related to exposure to these heat extremes include deaths, illnesses, heat illnesses such as heat stress, heat stroke, and heat rash and dehydration. We also see an increase in hospital and emergency department visits, especially for cardiovascular diseases and kidney-related illnesses and diseases. On my left here is just an illustration of one of the most severe impacts of heat waves. This was related to a heat wave that occurred across most of Europe in 2003, where Europe was subjected to the hottest heat wave in about 500 years. And that resulted in over 70,000 deaths, but the toll has been reported to have been much higher than that. I will also have some examples of the severe impacts of heat waves closer to home. You'll see here some deaths in the Northern Cape that were due to a severe heat wave, as well as in the Northwest. We also have numerous more recent examples of severe heat waves and how they impact health. Not only do heat waves affect human health, but they also affect the ecosystem, which all in all affects the general well-being of the environment. So, given the impacts of heat on human health that we've just covered in the previous slides, it's important that heat waves be defined and monitored by using heat thresholds that are related to negative health outcomes. However, there's no there's no universal definition of a heat wave. Typically, countries describe heat waves as a hot extreme or a number of hot days with temperatures above a given threshold. So the aim of our study was to investigate the distribution and the characteristics of past and future heat waves in South Africa by defining heat limits using a threshold for diurnal temperature range, which is based on a temperature and mortality relationship, which I will discuss in previous slides. So the importance of understanding heat wave characteristics is that the effects of heat are not only due to the physical phenomenon of heat itself, but also to the factors such as the duration and the frequency that impact how the body's physiology responds to heat. So one of the most important steps towards adaptation, heat adaptation, is developing heat health warning systems. So currently, heat waves are issued when a a town-specific threshold is exceeded, a maximum town-specific threshold is exceeded. For instance, if, let's say, Durban, the historical maximum was 40 degrees, and then the weather forecasts show that for the next three or more days, um, the temperatures will exceed that 40 degrees, then a heat wave is issued. But this doesn't have any link or connection to evidence of a negative health outcome. So what we did was, based on one of our previous projects, where we were investigating which temperature metric best predicts mortality counts during summer, we were able to identify one of the important heat metrics that could be used in a heat health warning system. So yes, that was part of that work where we were trying to develop a temperature metric to use in heat health warning systems so that we would have a consistent and standardized metric which we can compare internationally as well to be able to monitor heat extremes. So we used random forests to investigate the association between temperature indices and mortality during summer. Our models were adjusted for year and month to control for effects of long-term trends, as well as to account for timing in season. This is because studies have shown that heat impacts are more significant when they occur early in the season, as opposed to later in the season. We found that diurnal temperature range was the variable with the highest variable importance. This means that it had the highest predictive power with regards to mortality compared to the other indicators. As you can see here in the map, the lowest TTR thresholds occur along the coast, whereas the highest threshold are more inland. And projections of future climates using global climate models show increases in warmer days and decreases in cold nights. And the reason why cold nights are of particular concern is that the human body needs to cool off at night after being exposed to high temperatures throughout the day. But if the air stays too warm at night, then the body then faces extra strain because the heart pumps harder trying to regulate body temperature. So based on that definition that we estimated of diurnal temperature range of 12.8 degrees Celsius, we then use that definition to look at current and future heat waves. We used a period of 2 consecutive days above that threshold, and then we projected future heat waves using RCP 4.5 and 8.5 emissions. So in this analysis, we excluded all days where the mean temperature was below the minimum mortality temperature. And this is because at temperatures below MMT, then there's no definite risk, let's say, posed to human health. So in order to concentrate on the high risk days, we then excluded those days below that minimum temperature. So we'd be able to extract the days during which heat waves exceeded this temperature. We use the Heatwave R package in R to detect district level thresholds using that exceedance of DTR above 12.8 degrees Celsius. So this Heatwave R algorithm gives you information on the duration of the heat wave, the start of the heat wave, the peak, and the dates and the intensity as well. As you can see here on the map, the districts that experienced the highest number of hot days were in the arid regions of the Free State and the Northern Cape. And then due to cooler conditions, the coastal districts experienced a lower prevalence of days when DTR was above this threshold. And so you can see here that the risk of heat is not uniform across the country. There are certain parts that are more vulnerable to the effects of heat waves compared to others. And this is a very important distinction to be able to make. Heat waves generally occurred more frequently during the summer months. Coastal provinces experienced heat waves throughout the year, however, they were of a lower intensity. The inland provinces, however, experience fewer heat waves of a longer duration. Um, so we were able to detect one of the longest heat waves, which we found to be 77 days from October 2015 to January of 2016. And this was important because this corresponded to an El Nino event during which we recorded very high temperatures across the country, exceeding 40 degrees Celsius in many parts. So this definition of DTR above 12.8 degrees Celsius was able to detect the significant heat wave. And this is somehow not necessarily a validation, but a corroboration that this heat wave, this definition that's related to mortality is able to still detect significant heat wave events. Looking at the future projections, the greatest increases in heat wave days will most likely occur across the northeastern and northwestern parts of the country. The geographic extent of heat waves appears to be slightly wider under RCP 8.5 compared to RCP 4.5, with heat extremes of high intensity, frequency, and duration. Coastal districts are most likely to experience more heat waves of lower intensity under both RCP scenarios. So the policy implications of our study then is that the provision of data, methods, and evidence is important to support decision making with regards to understanding the exposure, the vulnerability, and the health impact, because these vary from one setting to another. And so heat adaptation has to be tailored to specific regions. Also, we highlight here the importance of adaptation and mitigation measures under current and future scenarios, because we were able to show the extent and the frequency of the current heat waves, but also future heat waves, to show that the situation is most likely to worsen, and therefore any combating measures need to be long-term. It's also important to develop early warning systems, because these then help with the timely implementation of public health interventions, which ultimately aim to reduce heat-related illnesses and deaths. Also, understanding heat wave patterns is important to support disease and vector control programs, because those diseases are generally climate sensitive. Continued research into the frequency and heat wave, into frequency, intensity, and duration of heat waves is important. We've covered that briefly. We also need to understand the spatial and temporal distribution of heat waves to inform targeted interventions. This means that if we allow then policymakers and emergency services to prioritize their actions and focus on the specific regions at high risk, also identifying what we would term as heatwave hotspots will allow authorities to focus on vulnerable populations within these hotspots. And also, we've covered this briefly before, but it's important to identify the attributes of heat waves to guide mitigation and adaptation strategies and policy development. Thank you so much for your time. If you have any questions for me or any comments or suggestions, please feel free to email me or contact me. I think my contact details will be available after my presentation. Thank you so much. Goodbye.
Thank you to both Dr. Nkangwani and Dr. Kapwata for really interesting and well put together presentations today. First of all, Dr. Kapwata, the work that's been done around the heat health warning system for South Africa using a different approach and a different metric, namely the diurnal temperature range, is fascinating work and definitely can see a change in how we assess heat wave risks across the country. There is a very deep concern for heatwave impacts in South Africa, given that we know that temperatures are expected to rise between 4 to 6 degrees Celsius in southern Africa by the turn of this century. Thinking about a health-based early warning system is critical at this time and would definitely lead to help guide action in terms of where to implement both adaptation measures as well as improved services. This work that's been done identifies these hotspots at risk and helps us guide where we should focus our attention the most. Dr. Nkangwani's work around heat waves with a focus on climate change in South Africa, including the projections of temperature in South Africa. Here again, we've got grave reason to be concerned. These projections are showing us that there will be an increase in record-breaking temperatures across the country, as well as an increase in wildfires. We've already seen a large number of very devastating wildfires, particularly in the Western and Eastern Cape. And it would appear that these are projected to increase in the future. The heat wave advisories that are issued by the South African Weather Service are extremely beneficial for the public because they give them information on what to actually do during a heat wave. The focus on vulnerable groups, especially on children and the elderly, as well as people with pre-existing diseases, is essential when it comes to dealing with the impacts of heat waves and heat on people. And when we look at those projections for heat stress, it is very concerning when we think about vulnerable groups who will not be able to necessarily physiologically adapt or be able to take the appropriate actions to protect themselves from the impacts of extreme heat. Dr. Nkangwani mentioned and emphasized the need for capacity building across all sectors. And I think both presentations confirm that the science that's being done is really necessary to underpin how we guide policy making, decision making, the development of guidelines and actions for the future. Thank you very much for joining us today. I hope you've enjoyed these presentations and we look forward to receiving your comments on these webinars through the platform where they are posted. Take care.